What I like about medical genetics is that it's such an exciting field.
I like the investigation part of genetics, like the trying to put things together, the ultrasound findings, the family history, the physical examination.
By the end of the day, when you go home from work, you always learn something new, and I think that's really unique.
So medical genetics never let you feel bored.
Medical genetics, compared to just about any other specialty, is always on the forefront of technology.
There has never been a more exciting and extraordinary time to consider a residency and career in medical genetics. Not only are genetics and genomics changing how we practice medicine, they're beginning to define and guide healthcare decisions.
We now have the ability to sequence entire human genomes on a clinical basis.
As that becomes more readily available to more of our patients, it's going to put new demands on everyone in the genetics community to interpret all of that information in a meaningful way to help improve the medical care for our patients.
For instance, if there is a patient that has multiple different symptoms, we can find that there's like a deletion of their DNA or something, but you can also find other genes that are also deleted and hopefully predict in the future things that might come up and actually screen for those things ahead of time.
Someone said something that's always going to stick with me. He said that right now, genetics is a subset of medicine, but pretty soon medicine is going to become a subset of genetics.
This is a field that really allows you to be a physician scientist like many of us want to be.
There is no medical specialty with more flexibility, more variety, and more options. From a focus solely on medical genetics to combined residency programs in internal medicine, pediatrics, OBGYN, and maternal-fetal medicine. There are several paths to choose from. Medical genetics is for every stage of life, from prenatal to newborn, and from pediatrics to adults. Medical genetics spans the entire lifetime of care.
What I think some of my friends in medicine envy me for are the diversity of my days. So I may wake up in the morning and see a consult in the NICU, and then right after that see an adult in their 50s with hemochromatosis, and then in the afternoon have consultations for folks who are concerned about their risk for cancer or interested in conceiving a healthy pregnancy.
You are actually the person who's in charge of explaining and working with the families and providing that counseling that no one else does.
The medical genetic practice allow you to not only take care one specific patient, but also let you have ability to take care of all the family members and the relatives.
You can have long-term continuity with patients, which you can help coordinate their care.
From diagnosis to management, and from rare diseases to the most common conditions, medical genetics is moving the practice of medicine forward and is at the center of medicine today. A career in medical genetics also offers a fantastic quality of life in a variety of settings.
In medical genetics, what really struck me is that my colleagues and superiors always seem to be very balanced in their life. They really seem to have a good work-life balance, and I think that still holds true. And it's something about the field of medical genetics because it allows you to accomplish most of what you do during your day, during regular business hours, and it still allows you to have a good family life.
The future of medicine lies in a better understanding of the human genome and how to apply it to every aspect of medical practice.
There really isn't any other specialty I could think of that is so forward-thinking and sort of on the cutting edge of new tests and new developments in medicine and in science.
All these new developments require people who think about them from an ethical perspective, from a technological perspective, from a clinical perspective, and you, even as a fellow, as a resident, as a junior faculty member, can be an integral part of that and be part of the whole discussion that's going on and be part of where the field really moves over the next years to come.
To find out more about pursuing a residency in medical genetics, contact these national organizations.